Tonight, stern warnings for Canadians. Stay home and keep your distance.
The advice is getting stronger and stronger. And with that stronger advice will be coming more and more penalties if people don't listen.
The message from the health minister is clear, but it appears not everyone is listening.
I'm scared because I think I have COVID.
Canada's trouble with tests. Why many presumptive cases still aren't getting tested. Our medical panel is here to answer your questions about the virus and how to protect yourself. Plus,
reach way up to the sky.
Creative solutions to keep businesses buzzing and little feet moving. This is The National. Appealing to people's sense of community, officials have been asking those with symptoms to self-isolate, those without to distance themselves from others. But not everyone has been answering the call, and now officials in some provinces aren't just asking anymore.
They are not recommendations. You must follow those guidelines.
We are dealing with a deadly virus, and this behavior is unacceptable.
More coercive means could be applied.
More coercive means now being contemplated by the federal government too, as some people continue to congregate and Canada's outbreak claims more lives. Since yesterday, 8 more people have succumbed to COVID-19. The total deaths in Canada now 20, at least 130 new cases emerging today. That brings the country's total to more than 1,400. But before we get to the efforts to protect Canadians here, we have some breaking news on the 2020 Tokyo Olympics. Canada, the first country to say we're not going. Leanne Young joins us with the latest.
That's right, Ian. We have just heard from Team Canada. They will not be sending athletes to the Summer Games in Tokyo. The Canadian Olympic Committee released a statement. Instead, they are urgently calling on the IOC to postpone the Games for 1 year. They say it's not safe for athletes, their families, and the broader community if they continue training. This comes after the International Olympic Committee has said canceling the Games is not going to happen. They may postpone, but they may also look at other possibilities to make the July 24th start date possible. The committee has given a deadline of 4 weeks to decide, and the COC says it appreciates having that timeline. So far, athletes have had a mixed response to the IOC's plan. We've heard from Hayley Wickenheiser, one of Canada's greatest hockey players and an IOC member herself. She had called their intention to go ahead with the Games. This was from several days ago, insensitive.
They're putting sport above health and humanity. The athletes of the world can't train. Many athletes, the pools are closed, the gyms are closed, the facilities are closed. But much more than that, they're worried about their families. If it's not safe, we shouldn't be there.
Others like Quebec's Brent Lakatos, an 11-time world champion in wheelchair racing. He wanted to see the Games postponed, but it's challenging. We're just about 4 months away from the Games, and these athletes are supposed to be in the best shape of their lives. Since the start of the first modern Olympics, the Games have only ever been canceled 3 times during the World Wars. So the Olympic Committee is hesitant to cancel, but they may have to postpone, as we could see more Olympic committees coming out to say what Team Canada is saying, the first team to do it. They won't be going to the Games if they are held this summer.
And at this point, Leanne, what sort of reaction are we seeing?
Yeah, we're just seeing some quick reaction on Twitter already. Some of the athletic associations all saying they support the decision. So Wheelchair Basketball Canada, Cycling Canada is also saying yes. Inaki Gomez, he is an Olympian. He's a race walker, and he says the right decisions are not always the easiest to make. Really proud of Team Canada. And we're also hearing from Ontario's Hilary Stellingwerf. She also says thank you to Team Canada for making that decision. So initial response is quite supportive at this point, Ian.
All right, Leanne, thank you.
You're welcome.
Well, the escalating outbreak may call for an escalating response from Ottawa and from Canadians. Ashley Burke explains the measures the federal government today told us they're prepared to use.
The government has been asking Canadians to follow its advice, but the days of asking may soon be over.
The advice is getting stronger and stronger. And with that stronger advice will be coming more and more penalties if people don't listen.
There are examples of Canadians not listening, like this scene in Vancouver. People clearly not social distancing, some calling the 2-meter rule overkill. But Canada's top health officials warn it's not.
It is not anecdotal evidence that we are using to make our decisions. It is science.
This is a serious issue. We need to deal with it right now.
The government says it'll be watching closely over the next few days. It's waiting to see if waves of Canadian snowbirds and travelers returning home actually self-quarantine for 14 days.
You do not stop for groceries, that you do not go visit your neighbors or your friends, that you rest in your house for 14 days, no exceptions.
If they don't listen to that advice, the health minister could drop the hammer using the Quarantine Act.
Let me be perfectly clear. We will use every measure in our toolbox at the federal level to ensure compliance. We have measures that could include monetary penalties up to and including criminal penalties.
Some provinces and territories are already turning to the police for enforcement. This new measure would mean a more uniform approach across the country. The biggest and final step would be the Prime Minister invoking the Emergency Act.
There are many things that are being done and can be done at the local level, at the municipal level, and at the provincial level. The Federal Emergencies Act is a significant step that can and should be taken when we've exhausted all other steps.
The longer people ignore the guidelines, the closer the government gets to taking extraordinary measures. But there's still only so much the government can do. People need to do the rest. Ashley Burke, CBC News, Ottawa.
Thousands of Canadians are still stranded abroad, but Ottawa is cooperating with airlines and foreign governments to try to get them home.
I just wanted to come home as soon as possible.
It was just really, really hard but finally we made it, so that's what matters.
A flight from Morocco arrived early this morning with several hundred Canadians on board. Air Canada is expected to operate 2 more in the coming days. More than 30 flights are in the works for Canadians in Peru, Spain, Ecuador, El Salvador, and Honduras. And the government had another announcement.
The House of Commons will be recalled on Tuesday at noon so we can pass emergency legislation that will put our plan into motion.
The House will be back in session briefly on Tuesday, but with just 32 MPs and the Speaker. Enough, though, to pass an emergency economic aid package. Parliament has been suspended until April. Already adding penalties for disobeying social distancing rules is Quebec. As Ainsley McClellan reports, the hope is that police intervention isn't necessary, but the party, any party in the province, is now officially over.
The list of public spaces and businesses open to Quebecers is shrinking by the day. Playgrounds around Montreal closed. All schools and daycares to remain closed until May 1st. And as of midnight tonight, all shopping malls, hairdressers, beauty salons, and restaurant dining rooms across the province also must close. This is on top of a decree Friday night officially banning all indoor and outdoor gatherings of any size. Montreal police have already received at least 80 calls from citizens reporting those suspected of violating the ban. Police are asking Quebecers not to jam 911 switchboards with these reports, and police on patrol will have power to break up gatherings at their discretion.
When we see gatherings, then we will really ask for the people's collaboration and their comprehension, and we will ask them to get separated and to respect the instructions.
But police can hand out a $1,000 fine or detain people if they do not comply. In Quebec City, police broke up about a dozen gatherings last night. Police say most people cooperated, but one person was arrested and held overnight to face fines for disturbing the peace and for insulting a police officer. These are extraordinary circumstances, according to constitutional lawyer Julius Gray.
The police has to use its discretion, but it may have to arrest some people. It's a clear and obvious reason enough. An emergency. Now, one thing that has to be remembered, and I think it's essential, the charter remains in force.
Premier François Legault says arrests will be the exception.
We want to use police and the force only in very few exceptions in order not to have any kind of chaos in our society.
And he's counting on Quebecers to take the measure seriously so that police don't have to intervene. Ainsley McClellan, CBC News, Montreal.
Nova Scotia became the last province to declare a state of emergency over COVID-19 and along with that enact some of the strictest measures in the country.
You walk to exercise, not to socialize. Stay in your neighborhood. Walk around the block or down the street.
Gatherings are limited to no more than 5 people. Those entering the province, not just from abroad, but also from the rest of Canada, will be checked and told to isolate. And individuals who refuse self-isolation or social distancing can be fined $1,000. We're joined now by Dr. Lenora Saxinger, an infectious disease specialist at the University of Alberta. And Dr. Saxinger, as we've heard, some premiers in particular starting to talk tough now about people who seem to insist on getting together in groups and encroaching on that 2-meter distance. From your perspective, what's the best way to get people to comply?
I think that what we will see is that a lot of people are doing a great job already. There's a possibility that some people may not yet be fully aware of the recommendations, and so that's a piece. But then I think there's another group of people who really don't feel or see the risk yet. Of course, once we start seeing increasing number of cases and people going to the ICU, the risk will become a lot more obvious and people might modulate their behavior. But ultimately, I think we have to try to target that group a little bit earlier because that's getting a little late for social distancing.
Yeah, so maybe people here are going to have to see examples close to them. You've already seen some examples in other parts of the world.
Absolutely, and I think there was one case that I actually like to make sure people know about is that over 1/2 of the South Korean epidemic can be traced to one individual who had a fever and went to a hotel buffet and then went to a large religious gathering. And the contacts of that individual were subsequently responsible for a huge part of their epidemic, over 50% of it. And I think that no one wants to be that person, and making sure that people recognize that actions as simple as going out to eat when you're feeling a little bit off or going to a church when you're feeling a little bit off can have huge consequences.
That is a great example. And stand by, we're going to talk to you a little later on in the hour.
Thank you.
With some BC residents enjoying the springtime weather a little too much, Vancouver's mayor said that tomorrow this city will be moving on its own to force people to keep their distance.
New bylaws that authorize enforcement and penalties to anyone violating these orders. Like I said, the time for asking is over.
The line between keeping active during the crisis and keeping safe is supposed to be drawn at 2 meters. Tina Lovegreen asked a medical expert about what you can do outdoors at a distance.
This isn't usually how Paul Witz practices his skills. Neither is making baskets where there is no rim.
Imagining there's a hoop there and trying to get some imaginary shots up.
The Vancouver Park Board took those away, and it's closing down skate parks, volleyball, and tennis courts too. It's even removing the iconic logs where beachgoers lean against because people weren't getting the message. This weekend, as the sun hit the pavement, people flocked to the parks, practicing everything but social distancing.
You see people in big groups and, not keeping that distance, so it's a little worrisome sometimes.
Also troubling, some people in Vancouver decided to have a boat party. Needless to say, that's not okay.
I'd like to think it's like a misinformation, misunderstanding thing as opposed to willful ignorance.
So what is allowed? Can you go for a walk, a bike ride, or a hike?
Sure, as long as you keep that distance, absolutely.
But when the seawall gets jammed like this and you can't keep 2 meters between you and others, it's time to turn around. What about catching up on a bench?
If you're really tired, if you suffer from some condition, you need to sit down for safety, okay. But when you really don't need to, just don't.
The point is to avoid touching surfaces. That's why playgrounds are closed and why playing team sports like basketball or soccer isn't a good idea.
Again, those are surfaces that now you're exchanging a frisbee or a ball, and that can easily carry the virus, so no.
And why picnics, even if you're 2 meters apart, aren't recommended.
Inadvertently, they're touching the same surface as someone else, and that can spread the virus.
So that means no sleepovers, no having your friends over for dinner, or house parties, unless it's over the phone like this. Hey guys!
It's time to get creative, finding ways to stay active, but away from others. Tina Lovegreen, CBC News, Vancouver.
Canada has started to ramp up testing for COVID-19, trying to increase capacity with a growing number of drive-thrus and walk-in sites. According to the Public Health Agency of Canada, close to 90,000 people have already been tested. But as Karen Pauls explains, access to the test may depend on where you live.
Construction crews are putting up a new coronavirus testing site in downtown Montreal.
By tomorrow, people can show up without an appointment on foot or in their cars. If they qualify, they'll be sent to a heated tent to get the test.
The main goal is to make sure that we can augment the number of tests the screening tests that we can do a day.
Drive-through testing is also happening in Winnipeg and Ottawa, among other cities. But in several provinces, the test may be hard to come by.
I'm scared because I think I have COVID.
Gordon Mose says he developed symptoms after flying through the Vancouver airport 6 times in the last month, caring for his 92-year-old stepdad as he underwent hip surgery.
I spent 10, 11 hours in the Prince George Hospital with various medical professionals. And if I'm sick, I've infected them.
Mose can't get tested because in BC, only high-risk people are eligible, including frontline healthcare workers and residents of long-term care homes. Other provinces are also limiting who gets the test.
There's a global challenge in terms of getting the supplies, materials, the testing kits, and so on.
This scientist says the pandemic could last for months, so tough choices have to be made. But
I would love for everybody to be tested so that we know how far this disease is transmitting.
Soon after Kyla Lee returned from a legal conference in Ohio, she started to cough, had chest pains, and got a fever.
I saw a doctor over the Cloud MD app, and they said essentially that I am a presumptive case of coronavirus.
Lee lives in Vancouver, so she won't get tested, but she's okay with that.
But the people who need the tests are the people we should be saving the test for.
Lee says anyone with mild symptoms should do what she's doing, stay at home. Karen Pauls, CBC News, Winnipeg.
CBC News has a team tracking every confirmed case here in Canada, and we've put together all that data in a special online interactive. You'll also find answers to frequently asked questions. Just go to cbc.ca/coronavirus tracker. In the United States, a nearly $2 trillion stimulus package was defeated in the Senate tonight, but negotiations continue as the toll of this virus grows. Tonight, the U.S. has more than 33,000 confirmed cases and more than 400 deaths. More than 100 million Americans, that's almost a third of the population, have been ordered to shelter in place. Donald Trump tried to reassure them tonight, but as Paul Hunter tells us, many state and local officials don't seem convinced.
At the latest drive-through testing site in hard-hit New Jersey today, huge lineups and long waits to be swabbed, with multiple states saying they're now desperate for more testing sites, more protective clothing, more ventilators, more hospitals. To the White House today, a forceful plea from the mayor of New York.
If the president doesn't act, people will die who could have lived otherwise.
Tonight, Donald Trump said he's ordered mobile hospitals to the 3 hardest hit states, including New York, and underlined the medical gear being supplied to those in need by the federal government.
For those worried and afraid, please know as long as I am your president, you can feel confident that you have a leader who will always fight for you, and I will not stop until we win. This will be a great victory.
Still, it's so bad right now, volunteers are making protective masks out of cloth while states face bidding wars to buy proper masks.
We're competing against each other. We're competing against other countries. It's a wild west, I would say, out there.
This as Republican Senator Rand Paul today tested positive for corona. A handful of colleagues are now self-isolating, including Republican Senator and Trump critic Mitt Romney.
Romney's in isolation?
Yes.
Gee, that's too bad.
And while some 100 million Americans are now on broad orders to stay at home, consider Washington, D.C. this weekend. On such crowds defying all advice, the governor of New York.
It's arrogant, it's self-destructive, it's disrespectful to other people, and it has to stop, and it has to stop now.
U.S. lawmakers, meanwhile, spent the day trying to finesse a $1 trillion aid package for the U.S. economy. They failed, but talks continue. Paul Hunter, CBC News, Washington.
Around the world, there are now more than 300,000 known cases. More than 14,000 people have died, and country after country is trying to prevent this pandemic from getting worse.
Guten Tag.
Today, German Chancellor Angela Merkel banned most public gatherings of more than 2 people. Then she learned a doctor who treated her Friday has tested positive for the virus, so she's now in quarantine herself. In just a few hours, people in Greece will be on lockdown. Leaving home unless it's necessary will be banned, and people will have to carry ID when they are out.
What happened at Bondi Beach yesterday was not okay.
After calling out beachgoers for ignoring social distancing this weekend, Australia's Prime Minister announced a swath of closures starting Monday, among them bars, gyms, cinemas, and places of worship. In Italy, the death toll jumped again today by nearly 700, bringing the total to more than 5,000. But there was a glimmer of hope. The number of new cases rose by the smallest percentage since mid-February. And on this Mother's Day in the UK, a message from Prime Minister Boris Johnson: visiting your mom could put her at risk. And stay away from everyone in public or stricter measures could come.
Stay 2 meters apart. It's not such a difficult thing. Do it.
Iran says it has the virus under control, but experts say the country is uniquely at risk.
If these precautions are not taken seriously, then this can lead to 3.5 million people dead.
Still ahead, what's really going on inside Iran, and how will it affect the rest of the world? Plus, will wearing gloves keep you safe?
It may be giving people a false sense of security.
And your questions, our experts, from risks to pregnant women to whether you can let others pet your dog. We get answers for you right after this. Mixed in with the anxiety and the shifting norms that this pandemic has created are so many questions about how to stay safe and healthy. And to help answer some of them, we're turning to a team of doctors every night with your questions. And tonight, let's bring in Dr. Lenora Saxinger again, an infectious disease specialist with the University of Alberta, and Dr. Michael Curry, an emergency room doctor from Delta Hospital, that's just outside Vancouver, here in British Columbia. And Dr. Curry, let's start with you. At what point of feeling ill should someone decide that it's time to go to a hospital?
So with the COVID-19 pandemic, we're expecting a lot of visits and a lot of business in our hospitals. So unless you're feeling substantially ill, we're advising you to treat respiratory symptoms as though they could be COVID and to stay home. Reasons to come to the hospital would be shortness of breath, so feeling like you've run a marathon and all you're doing is sitting on your couch, or a chest pain or chest discomfort. If it feels like a respiratory infection that you've had before, then I would try to stay at home and self-treat. But problems breathing are probably the hallmark that you could have a more severe case.
All right, Dr. Saxinger, for a frontline worker like a grocery store clerk or a bus driver, there are questions about how they can keep their family safe when they come home from work.
Right, so people who are going to be interacting with the public a lot more have to do the same core things that we're recommending, but with a lot more attention and intensity. So frequent hand washing, at least every hour, if not more often. Wiping down high-touch surfaces that people come into contact, that you come into contact with, frequently with an appropriate household disinfectant or a bleach solution. And this is getting into an excess of caution, but is a consideration potentially. I know some people are choosing to change clothes so that the clothes that they wore out and about are not the clothes that they come into the house with, and that they put those clothes directly into the wash. I think that some of these recommendations can change as we know more, but an excess of caution seems reasonable, and we do want to keep people safe.
All right, Dr. Curry, let's move on to the next question now. And what are the risks to pregnant women and the fetus and women who have conceived during this time?
So our understanding is that it appears from very preliminary research that the virus does not pass from pregnant women to their fetuses. So that's good news. In terms of pregnant women, we do know that the immune system during pregnancy tunes itself down. And so that may make pregnant women a little bit more vulnerable to an infection like this. Fortunately, pregnant women do tend to be younger, and there's data supporting that women seem to be a little bit less affected by this than men. So women should follow the same advice as for everyone else, but perhaps be a little bit more mindful of social distancing and self-isolating until the frequency and the amount of this virus in the community diminishes.
Dr. Saxinger, we're getting a lot of questions about pets and in this time of the pandemic. And here's one of them. Can I let others pet my dog if I'm on a walk?
This question is really about whether or not someone who has virus on their hands can transmit it to your pet, and then you pick it up when you pet your pet. This seems to be a pretty remote possibility. Things like fabric or more porous materials sometimes are not as good at transmitting virus because the virus doesn't come off the surface as easily. But I think in terms of general precautions, and because whenever people get close to dogs and they both have dogs, everyone gets all tangled up, it might just be best to maintain the physical distancing for your pet as well as yourself. But if someone does pet your pet, I don't think you have to panic. Everyone should wash their hands before they come when they come in the house, though.
We have about a minute left. That'll go pretty quickly, but I want to finish by asking each of you this, starting with you, Dr. Curry. A lot of anxiety out there on the part of a lot of people. What's your message to people who are watching this feeling a little nervous tonight?
So for most people, this is going to be a fairly mild illness. So the impacts of this virus can be mitigated by social isolating and following the advice of public health. Life is going on, but we are going to face some challenges in the short term.
And Dr. Saxinger, last word to you.
I think that it's a very strange calm before the storm time right now, and people are tending to get very focused on details and worried about them. I'd say what we should direct our attention to is doing the things we know we need to do, and focusing on how to keep our social cohesion and our spirits up as we start going into this unknown together. And so don't panic, be resolute.
As always, I know both of you, all of our experts, are so busy, and we really appreciate your time tonight.
Thank you, Ian.
As we've mentioned, we'll be asking your questions about COVID-19 each night on The National going forward, so keep sending us the questions you have. You can message us directly on Instagram at CBC The National, or you can send us an email at thenational@cbc.ca. Now, here's another question some people have been asking. Should they be wearing gloves when they go out in public? Respirologist Dr. Samir Gupta tackles that one for us.
So I do see people wearing surgical gloves out there on the street, and my patients have asked me if they should be doing this, and my answer to that question has always been no. And the reason for that is that I think people are wearing these gloves for the wrong reasons. Coronavirus doesn't get into our bodies through our hands. In fact, our skin is just as good, if not better, a barrier against infections, including viruses, than any man-made glove that you can buy. The way that the coronavirus gets into our body is through what we call mucous membranes, and that means the eyes, the nose, and the mouth. Now, the problem is that the average person touches their face about 20 times an hour. And so that coronavirus, which is on various different surfaces, gets transferred to people's hands, and then without them thinking about it, it goes onto their face. And wearing gloves doesn't really change that. In fact, the coronavirus on various surfaces will stick to the glove just as well, if not better, than it would stick to your hand. And so the glove doesn't prevent that transmission. In fact, it may be giving people a false sense of security, and they might touch even more surfaces, but then again, still transfer that coronavirus back to their face. The way that I use gloves as a healthcare worker is if I am going to see a patient with coronavirus, I'll start by washing my hands, and then I'll put on my gear, including my gloves. Then I'll go into the patient room, I'll interact with that patient, I'll come out, and then I'll take off my gear, dispose of my gloves, and then I'm going to wash my hands again. So the gloves really are meant for a single use. They're not designed for prolonged use or daily use. So the bottom line is you want to stop touching your face. And because we all tend to slip up, it's a good idea to just keep washing your hands. And you can think of it as each time you wash your hands, you're putting on a fresh pair of gloves. And if you really want to control your hands, just stick them in your pockets and leave them there.
Still ahead on The National, challenging times call for a bit of creativity, how some Canadian businesses are operating in this time of COVID-19. But first, cheese. Here's how two photographers are using social distancing to capture this moment in history with their porch portraits.
This idea came up from my wife, actually, who, after I lost a couple of my gigs due to COVID-19, she said, you know what you should do to make some money is to do family portraits through their windows.
I like the idea so much. It's a way to connect with people who are in isolation, practicing social distancing, and a way to create a happy moment for them, maybe in an otherwise dreary time.
I just come up to their window, knock, call them on speakerphone, give some direction, snap a few shots, and on my way. Not everybody is looking sad. People are smiling, having a good time.
Just looking forward to seeing a bunch of people out there and having a great time at it, and maybe spreading a few moments of cheer.
Team Canada says its athletes will not be attending the 2020 Olympics in Tokyo if they aren't postponed because of the COVID-19 pandemic. Today, the IOC declared it will take the next 4 weeks to make a decision on the Games, scheduled for July. Australia telling its athletes to prepare for a postponed Olympics, Canada hoping for the same. Many of the early Canadian cases of this coronavirus have been linked to travel to Iran. It has more than 21,000 confirmed cases, one of the highest in the world, and experts say that number is almost certainly underreported. Terrence McKenna takes us inside the outbreak there for an up-close look at how it unfolded.
This is the view of Iran the regime would like you to see. Beautiful shots of tranquil cities, people lining up in an orderly fashion to have their temperature checked at roadblocks. All images of a situation well in hand, reinforced by the soothing commentary of a designated government spokesman.
ولی خدا رو شکر جزو کشورهایی بودیم که سریع اینو مدیریت کردیم و الان جزو کشورهایی هستیم که لول اولی هستیم که داریم این کرونا رو مدیریت میکنیم. اینو شعار نیست، واقعا حقیقته.
Not quite. Not only did Supreme Leader Ali Khamenei not manage this situation well from the beginning, he in fact denied there was any problem. He said the outbreak was a hoax, propaganda from Iran's enemies. Today he acknowledged it was real, but likely planted in Iran by the United States. Iranian-American Barzu Daragahi covers Iran for the British newspaper The Independent. He says the regime at first provided two explanations for the outbreak.
One is it was propaganda aimed at, besmirching Iran and China and so on. And the other is that it's some sort of bioweapon. And you hear that from, people, loonies on all sides around the world, including in Iran.
But soon there was undeniable evidence from the holy city of Qom that the outbreak was underway. Cell phone video emerged of coffins being hurriedly buried at a cemetery, along with allegations that deaths were being covered up.
بیش از 80 نفر تا الان تو این قطعه خاک کردن. میگن 34 نفر کشته.
Iranian President Hassan Rouhani eventually acknowledged that there was a problem, but suggested it was not serious enough to require any quarantine. In fact, he encouraged people to vote in the February 21st elections.
The regime was a disaster in the way it handled it.
Canadian journalist Graham Wood covers Iran for Atlantic Magazine.
So if it had early on just said, the city of Qom needs to be contained, you have to practice extreme social distancing, and please do not go out in the street to vote, then they would have probably slowed down the epidemic and maybe bought themselves some time to not be completely paralyzed by it.
Then came the infamous scene with Iraj Harirchi, Iran's deputy health minister, trying to play down the outbreak while coughing and sweating on camera. It was soon revealed that he had contracted COVID-19.
And that gave people an indication that maybe the government doesn't have this in hand if the person who's responsible for fighting the virus is standing there coughing on his colleagues, sweating around them, and probably involved in a super spreader event himself on camera.
Trita Parsi is the founder of the National Iranian American Council.
When you have a government at a time of crisis, at a time of a pandemic, and there isn't public confidence and trust in what they say and what they do, then that just makes the pandemic and the crisis around it all the more dangerous.
Sure enough, the virus started spreading through the upper ranks of the Iranian government, including Vice President Massouma Ebtekar, who sat just feet from the president at a leadership meeting. Then a very senior member of the council that chooses the supreme leader died of the virus. And before long, the list of the infected and the dead in the upper ranks of the government became astonishingly large.
And so I think there's also a case where a lot more people in Iran have it, but the ones that stand out are the ones who get the test, and the ones who tend to get the test and go to the front of the line to get the test are the political elite.
Over the years, there has been a distinctive characteristic of Iranian society that makes it especially vulnerable to a pandemic: the devotion of intense religious believers on display at local shrines.
And this is almost perfectly what you're not supposed to do during a contagious epidemic, that is touching your face, touching pieces of metal that other people have recently been touching. And so the rituals that have been enacted for hundreds of years there are unfortunately well designed to spread a virus like this. So there have been some imams, some ayatollahs who have said, keep on doing this, keep on doing this. God likes it and he'll protect you.
The government announced that because of the pandemic, the religious shrines would be closed. The local imams would have none of it.
This is tremendously dangerous. We have now a study from a leading university in Iran that says that if these precautions are not taken seriously, then this can lead to a pandemic inside of Iran that would leave 3.5 million people dead.
Several true believers recorded themselves licking the gates of a shrine, supposedly to clean off the coronavirus.
It shows, I think, the danger of fundamentalism in Iran, as well as other places where extremists feel the need to assert themselves.
The government put out propaganda images showing men with fogging machines supposedly disinfecting entire streets, which most experts regard as useless in fighting this virus. Meanwhile, horrific videos began appearing on Iranian social media, showing the real depth of the crisis. In this one, recorded in the Qom morgue, the dead are piled up in body bags on the floor because there is no place to put them.
They've got a terrible problem there.
This week, U.S. Secretary of State Mike Pompeo announced that, in spite of the pandemic, the United States was increasing sanctions against Iran. Many see that as a grave mistake that could hurt the rest of the world.
If this virus is allowed to fester and grow in any other country, the risk of that spreading elsewhere is significant, very, very significant. Now we know quite clearly that in this globalized world with this amount of interaction, the spread of the virus anywhere actually constitutes a threat to humanity everywhere.
Iran marked the Persian New Year on Friday, an occasion that usually involves family celebrations and perhaps a visit to the cemetery to honor departed loved ones. Instead, the celebrations are canceled, and trips to the cemetery are reserved for new burials of family members. Today, the Iranian death toll reached 1,685. Terrence McKenna, CBC News, Toronto.
Even in developed countries, we're not sure whether the drastic steps being taken to slow the spread of COVID-19 will be enough to keep the healthcare systems from being overrun. Now imagine the risks in the world's overcrowded refugee camps. Margaret Evans explains.
The front line of human misery. It winds its way around just about every corner of the globe. But how do you fight yet another potential foe when you're already on your knees?
When 20,000 people are living in a very confined space where there's almost no access to toilet, to washing points, it's impossible to self-quarantine.
This is the Moria refugee camp in Greece, already a petri dish of ailments easy to pass from one to the other.
These people gathered in such a confined
Mia Thurkelson of Doctors Without Borders says if the coronavirus hits populations like this one, it has the potential to decimate.
I'm very, very concerned if this is going to spread, and I think whatever measures we're going to take, it's never going to be enough.
There are more than 70 million forcibly displaced people around the world. NGOs like Save the Children are asking donor governments not to forget them.
Populations that have been really battered by weak health systems, by poor public health infrastructure, they are really the most at risk at the moment.
Not as easy to help, though, when so many countries are battening down the hatches. This is Syria's stricken Idlib province. More than 1 million refugees huddled up against Turkey's border. Aid groups are only now getting temperature kits.
We hope that the number of thermal detectors will be increased.
Osama al-Hussein says raising the alarm about a virus is a challenge when people are faced with conflict.
The huge interest of the whole globe of one virus is for Syrians is something very small in comparison with the crisis, with the misery, with the bombardment, shelling, killing.
It all combines to fuel a virus that preys on the weak. Margaret Evans, CBC News, London.
Here at home, small businesses have felt some big impacts. Some have had to lay off staff, others have closed. Next, one woman who's changed her whole business model to make it work. The coronavirus has forced many Canadian businesses to close down. As for the ones that are still open, there's a new level of vigilance. Now, for some businesses, survival means getting creative, like using technology to stay connected to clients, even the smallest ones. Tashana Reid has an example.
For many Canadian businesses, pressing pause on work isn't really an option. And for Jen Niels, who I'm about to speak with, well, she's had to learn to adapt her business pretty quickly. Hey, Jen.
Hello, how are you? My name is Jen Niels, and I'm the owner and creative director at Little Rebels Music and Development. Little Rebels Music and Development focuses on cognitive learning and muscle development, but we do it all to music. We would have a group of 6 to 12 kids, mostly neighborhood kids, that all come together into one home. And then we as teachers arrive at their home with all of our equipment.
What do your classes or these sessions look like now?
So for the rest of the month, we are all online. Having a bath, which is so timely. Wash your hands, wash your face, don't touch anything. Currently, we have 71 classes that we teach a week. So those 71 classes now have their own private class with their own private teacher on Instagram.
The company has had to issue some refunds to parents who just aren't interested in an online session. But for parents like Amy O'Brien, well, it's been a big help. Hey, Amy, it's Tashana from CBC.
Hi, how are you?
I know you and your husband have been forced to work from home. How's that been going for you guys?
It honestly has been a little bit tricky, but we're trying to make it work. Both of us, our job relies on being on calls, on meetings a lot. I have 2 daughters. My oldest is Avery, and she's almost 4 years old. And my little one is Devin, and she's 16 months.
Tell me a bit about how they responded to their music lesson.
Well, both my girls love music in general. So when they hear music, they right away want to get up and dance. Like, even though it was not in person, they were really, really, really receptive, just really, really happy. I mean, we miss seeing all of our kids. We miss seeing their faces. We miss seeing what they're doing. But we still use their names. We still make sure we wave hi to every single child that we know is in our personal classes. So we're still doing our best to connect in that way. Reach way up to the sky.
It's clear the coronavirus is changing the way we work, but it's not stopping Canadians from getting work done.
Now wave your hands like so.
Tashana Reid, CBC News, Toronto.
Next on The National.
Come over to the window, my little darling.
A rousing round of a Canadian classic belted out of balconies is our moment.
It's time that we began to laugh and cry.
Some musical relief tonight in Montreal. Folk singer Martha Wainwright live streamed this performance from a balcony, and people around the world sang along. You may have guessed the song is So Long Marianne by music legend Leonard Cohen, and the goal to stay connected in our increasingly isolated world. Their moment of harmony is our moment.
So long, Marianne.
Even though there's a calmness on the street, you know, there's, I think, a lot of tension inside and a lot of unknowns and a lot of anxieties and fears. So singing feels good, but then singing together feels even better. There's something that's incredibly powerful about that. that makes us feel together. And this is a time when we really, 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 really need to feel that way.
They all say that you're beside me now.
Hopefully it'll inspire people to play music over this time in their own homes or on their balconies. Pick up a guitar, pick up an instrument, sing with your kids.
It's time that we began.
Sing the songs that you love by great Canadian artists like Leonard Cohen, but more importantly, sing your own songs. Let's keep writing the next great Canadian song.
About it all again.
Isolated in our homes, connected online, singing together, it all sounds fantastic. And what I'm curious about is what's next? What's the next kind of worldwide community online gathering during this time of COVID? I guess we're going to find out. That is The National for Sunday, March 22nd. Good night.